Evening, everyone. Thank you so much for joining in once again. We had a good time last week as we kicked off this series of conversations, let's say. Let's call it that conversations related to maternal mortality in the United States. We looked at all of the different underlying causes, what particular populations of women, in terms of people of color, that it really affected. We also reviewed racism in medicine. We did that to bring the audience some understanding of what happens when you lose agency, meaning control over your own ability to take care of yourself, and also to look at what happened in our country when there was lack of consent provided. All of this is noted to help you understand how important it is for you to have information, to know yourself, so that you are actively involved in decision making throughout pregnancy, the birth process, and after your baby is here. What we're going to do tonight is to begin putting all of this together. We talked also the last couple of nights about the preconception visit, how to get ready for that, what actually happens in that preconception visit. The whole idea of the preconception visit is to help you get prepared to have a healthy pregnancy as much as you can, to prepare your body, your mind, your finances, your social supports, all that's needed to be able to have a healthy pregnancy, healthy baby, healthy family, all of that. So, we're going to start looking at the risk factors. It's important for to know yourself, because as I noted last week, some of the issues with maternal mortality in this country is the lack of time for providers to sit down and thoroughly review things with you so that they know you. Often women are seen by more than one provider. And again, they're not going to have the time to come in, review your chart, look at everything, and know what's been going on with you. That's why it's so important for you to know you. So this week, what we're going to do is to look at some of these risk factors and compare them to what were your findings with the preconception visit. You were to begin to get information on your own family health, on your own personal health. If you've had pregnancies before, what happened with those pregnancies? What happened at the time of birth? Were there any problems? All of this information is going to come into play now as we talk about the different risks. I want you to pay very close attention to this because this is your information. You are the one who can make changes, who can make people pay attention to things that they may not have seen or been able to observe. So tonight we're going to talk about, am I at risk for hemorrhage? Give me a second while we get these slides up. Once again, we talked about the reasons for death, and what I want to do is each night spend time on each of these particular items that are the major causes for maternal death in the United States. Tonight, we're going to deal with hemorrhage. It's important to know that hemorrhage happens during pregnancy, and it can also happen at the time of birth and after birth. If we go back and look at the timing of when maternal deaths are going on, they are happening the day of and within the first 7 days after you've had your baby. First week, okay? Day of. And also during pregnancy, 47% of deaths are happening within that time frame. That time frame, once again, being during pregnancy, the day of pregnancy, and within the first 7 days following pregnancy. 53% of deaths happen after the first week after you've had your baby and go until 1 year later. I'm going to enlarge this. We'll be able to see it a little better. So during pregnancy, it is possible to have bleeding. And I want you, this would be what we would call one of the danger signs of pregnancy. And for bleeding that happens usually during pregnancy, it can be due to what's called placenta previa is one of the causes. And with placenta previa, what that means is that the placenta, where it has implanted in the uterus, is very close to the opening of the uterus, or what's known as the cervix. And as you're able to see on the slides on the right-hand side, you will see that normally the placenta will implant attached to the wall of the uterus, means the same thing, higher up or on the side of the uterus, okay? But when the previa happens, the location of where the placenta attaches to the wall of the uterus or implants is lower down. And as you can see, you may have an area where it is a low implantation, where it's close. This is your cervix here, where it's close to the opening of the cervix. You may have a partial where it's covering a part of the cervix, or it's a full placenta previa where it's totally covered the cervix. And the only way to really find out about this is by sonogram, to be able to know where is the location. Now, the symptoms that you will have will be vaginal bleeding. There will be no pain because this is not caused by contractions. You just have bleeding, no pain associated with this. Usually, this kind of bleeding can be bright red. What I want you to also begin to think about is to be able to describe the bleeding, because that will help your provider to know more information. When did this bleeding happen? Did it just start on its own? Did it start after intercourse happened? When did that start? Are you feeling any pain when the bleeding happens? Any pain when the bleeding happens? How much bleeding did you get? And the easiest way to begin to describe the amount is to think about the size of coins. Was the bleeding the size of a dime, a size of a nickel? Was it the size of a quarter? How much bleeding did you get? Did you need to begin wearing a pad for the bleeding? What I want to emphasize is that if you have bleeding during your pregnancy, you want to get immediate attention. My goal with this series of talks, conversations that we're having, is to decrease maternal death, decrease deaths of the infant as well. And so let's not play with this. Let's not second guess this. Let's go immediately and get the attention that's required. I want to say for families and women, please throw out the idea that, oh, it's at nighttime, I don't want to bother my provider. Excuse me, you are paying the provider to give you care. You also want peace of mind. So you need to call them if it's 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock. I don't care what time it is. You need to call them, and you need to get the immediate attention that you need. Sometimes you just show up in the emergency room if that is what you need to do. But do not sit on this. Do not sit on this. The risk factors, and this is where you can begin knowing yourself, knowing what is going on with you. The risk factors for hemorrhage. Hemorrhage appears to occur more often in the Asian population. And so if you are of Asian descent, your possibilities of having hemorrhage is higher than the general population. The other things are your own personal history And then your pregnancy history, if you've had babies before. Did you have a history of hemorrhage with your previous baby? If so, you will likely be at higher risk for having that be repeated again with this pregnancy. Did you have a long labor? A long labor is a cause for possible hemorrhage. Was your labor augmented? Meaning, did you get Pitocin to help your labor along? This is a risk factor for hemorrhage. Was your labor very quick? Did you have a fast labor? There can be what's known as an overdistension of the uterus, meaning that the uterus is stretched out. You know, if we think about a balloon, you can overdistend the balloon, okay? And this can be due to having twins, multiple pregnancies. Also, if you have a lot of water, amniotic fluid, it can, what we would call polyhydramnios, that can cause the uterus to be over distended. If you've had any sort of operative delivery, such as cesarean section, is one example that can increase the risk of hemorrhage. And the last is whether or not there is an infection of the bag of waters itself. These are things to be aware of. And these are things that you can begin to write down for yourself in your journal and gather this information, because you can be the one to bring this to the attention of the provider that's caring for you during pregnancy and caring for you in labor. A lot of times, we are not going to see the same provider that you saw during labor be your provider who's there. The providers that you saw for prenatal care may or may not be the provider that you see during labor. And so it's important for you to know this history, to bring this to the attention of the providers if they're not already discussing this with you. So what would happen if I had a hemorrhage? Once again, during your prenatal period, you want to seek immediate attention. Often, a sonogram would be done to see where is the placenta, where is the location of the placenta. You want to follow your health provider's instructions as to what should happen. And in some cases, this is not going to say it's going to happen all the time. Cesarean section might be needed. If the placenta, let's go back for 1 second again to take a look at this. If you have placenta that's totally covering the cervix or partially covering the cervix, keep in mind that when you go into labor, what labor is doing is helping or opening this cervix. All of your contractions are going to open up this cervix so that your baby can come through. If the afterbirth placenta is sitting on and around this cervix, the contractions will cause that placenta to tear even more, and that can cause major problems. And so cesarean section is often considered to be the safest route for birth of this baby. Okay? So if you have any questions or concerns, feel free to place those in the chat for me. I wanted to say also, I'm sorry, I missed one little section. Post-delivery, if there's what would happen would be the treatment of any of the causes that might be causing this hemorrhage. If you had Pitocin or oxytocin or some sort of oxytoxic medication, which will help to cause the uterus to contract down, will be provided to you. If there is a presence of infection in the bag of waters, then you would be receiving antibiotics for treatment. So these are the sorts of things that can happen. So this is the information. I'm going to ask you to please subscribe to my channel if you like the information received. Feel free to post any comments to me, and I will be happy to get back to you with any answers that I can. Tomorrow night, we're going to be looking at another risk factor. We will be doing that throughout this week. So thank you again, And I appreciate your time and look forward to the next time that we're together for our next conversation. Thank you so much. Have a good night. Bye-bye.